Hello and welcome to the LQAS online series sponsored by the Core Group through its Monitoring and Evaluation Working Group. In response to demand from the PBO community implementing child survival projects, the M&E Working Group is glad to bring to you a series of 6 LQAS lectures, starting with lecture number 1 today. The lectures recorded in Illuminate will be posted online on Core's website for universal access over the Internet. Each recorded lecture will be followed up by a live discussion 1 week after the lecture gets posted. During the live discussions, participants will be able to ask specific questions related to the previous recorded session. While each lecture will last approximately 30 minutes, live sessions will be scheduled for 45 minutes. The lectures are primarily targeted to implementers and program managers sitting either at headquarters or in the field who are in charge of child survival projects. However, we welcome the participation of the greater maternal and child health community, as well as other communities involved in public health programs implemented in developing countries. We will be covering key issues regarding the lot quality assurance sampling, known as LQAS, and we will have the opportunity to address some basic theory behind this powerful sampling technique. However, we will focus on practical issues to consider when using LQAS in the context of child survival projects, with plenty of examples. Although we will focus on LQAS applications in child survival projects, the same theory and recommendations may apply to other similar projects implemented in developing countries. The lectures have been prepared and designed by Bill Wise from the Department of International Health at Johns Hopkins Bloomberg School of Public Health, and myself, Juan Carlos Alegre, Chair of the M&E Working Group at CORE and Director of M&E at Project Hope. We would like to thank all members of the M&E Working Group for providing great input and feedback in the composition of this first online lecture. Today, as we start with lecture number 1, we will address the basic principles of LQAS to better understand this sampling technique and set the ground for the topics and applications we will touch in the next 5 lectures. On behalf of CORE and the M&E Working Group, we thank you for your attention in listening to this lecture, and we welcome your participation in the live session a week from today and in future ones in the weeks ahead. Let's get started. In order to understand the basic principles of LQAS, we would like to focus our attention in 4 specific objectives as stated in this slide. By the end of this lecture, you should have a better understanding of how to choose a sample size when using LQAS, and what are the considerations for selecting a decision rule. You will be able to identify what a small sample of 19 can and cannot tell us. This lecture will also provide the basis for using data collected through LQAS for evaluation purposes as well as for monitoring purposes. Through practical examples, we will address the differences between using LQAS when monitoring project activities and using LQAS when conducting either baseline assessments or final evaluations. By the end of this lecture, we would like you to have understood the basic principles of this powerful methodology and set the ground for the future topics of the lectures in the weeks to come. Before we get into the nuts and bolts of LQAS, first we would like to define what we understand when we use the term LQAS. Although lot quality assurance sampling can be defined as a stratified random sampling methodology to be used in quantitative surveys, the application of this methodology goes beyond the boundaries of any sampling methodology. LQAS can also be defined as an analysis method to improve quality of services through supervision at the local level. Therefore, we would like to refer to LQAS as lot quality assurance and supervision as well. To give you a little bit of history, LQAS was first introduced in the production industry at the Bell Labs in the early 1920s with the purpose to assess the quality of industrial products coming out from a batch production system. But it wasn't until the mid-1980s when LQAS was adapted from its industry application into public health programs. Since then, LQAS has been used by many organizations implementing public health projects, particularly those implemented in developing countries, and those that include interventions that focus on mothers and young children. LQAS is a sampling and analysis method that can be used at the local level to identify priority areas, areas that are at high risk for a specific indicator or a set of indicators. When we talk about local level, we would like to introduce the concept of supervision areas, management units within the project catchment area that can be supervised effectively by local supervisors. Results from LQAS data will give us enough information to identify priority areas that are not reaching an established performance benchmark for an indicator or a set of indicators adopted by the project. In addition, results from LQAS data will provide enough evidence for local managers to be able to make informed management decisions and also for sharing information within supervision areas. In addition to obtaining data for making decisions at the local level, results from surveys that use LQAS can also produce enough information to calculate coverage rates for the entire project catchment area by aggregating or adding data from all supervision areas. This is more suitable for reporting purposes and especially for assessments conducted at the beginning of the project, those baseline assessments that we all know, and for final evaluations as well. In a few more slides ahead, we will see the differences between using LQAS data for monitoring purposes, used at the local level, and using LQAS data for evaluation purposes, used for establishing coverage rates at an aggregate level. Finally, whether we use LQAS for monitoring purposes or for evaluation purposes, LQAS uses a small sample size, most frequently less than 20 observations or interviews per supervision area. With such a small sample, we will be able to obtain statistically significant results to make informed decisions either at the local level or for the entire catchment area. Larger samples are rarely needed to make those management decisions. Let's take a look at an example of how LQAS works in real-life projects. Let's assume that the green area represents the entire catchment area of our project, and that we have been assigned to measure coverage of services offered by our project so we can better allocate limited resources we have available throughout the life of the project. After many deliberations with the local team and partners on how to do this task efficiently with the available resources, the project team decided to conduct a survey using LQAS to assess current coverage of services and to be able to make informed decisions for allocating limited resources efficiently. The project team decided to establish 5 supervision areas within the project catchment area and identified 1 local supervisor to work in each of the 5 sub-areas with the primary purpose to assess and supervise the quality of services at this local level. Based on LQAS principles and taking into account some statistical parameters in order to obtain statistically significant results, the project team in each sub-area will randomly select 19 observations from randomly selected households in order to assess the performance of each sub-area and to measure coverage rate for the entire catchment area. Results from LQAS using a relatively small sample size, mostly 19 random observations, will allow us to identify which sub-areas are performing good and which ones are not performing so good. This is one of the major advantages from using LQAS, the ability to identify with enough certainty and with a relatively small sample size what sub-areas are performing as expected or above an average coverage, and which ones are performing below our expected benchmark or below an average coverage. And this can be done at the project level fairly rapidly and even without the need to wait for computerized statistical analysis.